Good morning and welcome to the Public Health and Minority Health Disparities Subcommittee. Today, our committee is meeting to discuss House Bill 53, House Bill 111, House Bill 302, and House Bill 340. I'm going to go ahead and jump us right in. I believe that Erin Hopwood, who is our staff, is on the call. She is. Erin, we're going to start with House Bill 53, which we heard last week. Could you remind us about this bill and talk us about the amendments? Tell us about the amendments we have in our packet.
Sorry, I was on mute and I couldn't hear you, but I think you just asked me to explain House Bill 53.
Explain House Bill 53, and also we have an amendment in our packet, if you could explain that too.
So House Bill 53 generally codifies the Maryland Statewide Independent Living Council, which was created by an executive order in 1993 in accordance with the Federal Rehabilitation Act as an instrumentality of the state. There are amendments that are being offered by the bill sponsor, and there's a reprint that was provided. If you look on page 2 in line 2 of the reprint, there's a definition of centers for independent living, which means a community-based organization that's designed and operated by people with disabilities. The amendments clarify in line 4 that the designated state entity has the responsibility for providing administrative support and disbursement of funds to the council to carry out the state plan. On line 15, there is a clarification that the council must work in conjunction with the Centers for Independent Living. Then on page 3 in line 10, there is a clarification that the board may continue to execute the duties of the council in the event of a vacancy. And on page 4, the authority for the council to adopt a seal is repealed.
Excellent, thank you. And I see Delegate Forbes is here with us. So Delegate Forbes, normally what I would suggest we do is adopt the sponsor amendments with the consent of the committee and then discuss the bill as amended. Is that, do you want to just speak on why we need the amendments and then we can adopt those amendments and then have a discussion on the bill?
The amendments were just drafted latest technical amendments, just to clarify.
Perfect. Do I have a motion on the amendments before we discuss the bill as a whole?
Move the amendment.
Second.
Excellent. They've been moved and seconded. Any discussion on the technical amendments? All in favor say aye. Aye. Anyone who's opposed, raise your hand in the chat. I see unanimous support for the technical amendments. Thank you, team. Delegate Forbes, do you have anybody here who you wanted to speak on this bill, or do you want to explain to us why we need to be passing this excellent bill that had a very good hearing?
I refer to my written testimony. Michael Bullis is here, who asked the advocate who asked me to bring the bill. And if you have any questions, he's happy to answer them.
Perfect. Thank you so much. Do we have questions from the committee about this bill? I'm looking for hands up. Sounds like everybody is pretty favorable towards this bill. Mr. Bullis, do you want to add 2 or 3 sentences before we move on the bill?
Can you hear me?
Yes, absolutely.
Yeah, I would say that there are some, unfortunately, there are still some more technical amendments coming your way, and we're working with Legislative Council to get them as soon as possible. But thank you very much for moving these amendments.
So do we think, and I don't know, Ms. Hopwood, are you aware of these amendments coming in?
I was not. I'm not sure what council you're working with, but
I would say they won't change the bill. So, like what it does.
No, they'll be exactly the same.
It still makes them an independent, allows them to become a nonprofit. It'll be a clarifying or technical amendment.
Okay, so it sounds like we might want to wait until the subcommittee meets again to adopt further technical amendments before we move on the bill as a whole. I see Delegate, I saw a hand up and it was Delegate Hill. Yes, go ahead, Delegate Hill.
Thank you, Madam Chair. Sometimes we adopt sense of amendments, but it is early, so there's no rush. So I know that you're saying it's technical. I think it would be helpful for the subcommittee to understand exactly what you're trying to do and what you've asked the amendments to do, because it's possible that we might want to just move on the sense of or something.
So there was some confusion that this was creating a new council or a new board, or both things. And if you see the fiscal note where it says that the assistant attorney general would need a whole assistant attorney general to staff this new entity, I've had discussions with them yesterday and said it's the same entity you've been staffing that meets 4 times a year. So we asked them to reconsider their fiscal note, and we wanted to clarify in the bill to make sure there was no confusion.
So we're just talking about clarifying language that there's no new staff needed.
Well, and that there's no need, well, we don't understand, and we've asked questions about this, and maybe legislative services will help us understand it, but the bill refers to a board and a council, and really there's only the council. And where it becomes confusing is that in various places in the bill, it refers to the duties of the board. And we're just trying to get them to be clear that it is one council and not a board.
Okay, so I'm going to recommend, because of the sake of time and to Delegate Hill's point, that we got plenty of time to get this bill out. Let's make sure we have the language exactly right, and we will bring this back next week. If we need more technical amendments, we will adopt them. Is the committee comfortable with that? And Delegate Forbes, don't worry.
Well, we appreciate it. Thank
We'll
you.
take care of it exactly how you need it by next week. Okay, let's move on quickly to House Bill 302. I believe Delegate Shetty is here. House Bill 302 is the Public Health Rare Disease Advisory Council bill. Erin, can you remind us about this?
Sure. This bill establishes a Rare Disease Advisory Council to enhance research and provide policy recommendations on matters related to individuals living with rare diseases in the state. The council's general duties include performing a survey to establish the needs of rare disease patients, caregivers, and healthcare providers in the state, developing policy recommendations, creating a publicly accessible website, providing an annual report to the Governor and General Assembly, and providing recommendations to address the needs of individuals living with rare diseases in the state. Delegate Shetty has offered amendments, and they have been provided to you in a reprint. The amendments add the chair of the State Advisory Council on Hereditary and Congenital Disorders to the council. That's on page 2, line 4. And it adds on page 3, after line 8, a representative from an organization that provides care management for individuals enrolled in the state's rare and expensive management program. On page 5, lines 1 and 2, this strikes the requirement that the council evaluate and make recommendations to implement necessary improvements to the State Newborn Screening Council. And the amendments also clarify that recommendations made by the council regarding coverage of prescription drugs for rare disease patients would include patients with private health insurance coverage.
Excellent. And I believe I saw Delegate Shetty on my screen somewhere. There's so many people here. Delegate Shetty, you are, yes.
I'm here.
How can we help you? Do you want to tell us about your amendments first and we can adopt them and then discuss the bill?
Sure, I can do that briefly. So the amendments, more specifically, one of the key parts of the amendments is that it eliminates the newborn screening part of the original bill as introduced. That is to further clarify that we already have a group that is working on that. They're doing a great job. We want to remove the duties of newborn screening from this new council, but we want them to collaborate. And so one of the members added is the chair of that group. We also, and that addresses actually most of the amendment requests from all of the favorable amendments plus the Department of Health's informational testimony. We also, I believe that these conform to the Senate passed bill or Senate committee passed bill, which passed on the 16th of February, unanimously.
Excellent. Okay, so do the members of the committee, anyone on the committee have questions about the amendments, or does anyone want to move the amendments?
Move the amendments.
And
Second.
seconded. Excellent. Any discussion about the amendments, which seem to make sense to me, and I love conforming them to a bill that passed the Senate already. Sounds good. Seems to make the stakeholders happy. Conversation on that. I see Ada Hamash. Is it just a question you have about the amendments for the committee?
I have a question about whether it's possible to clarify one amendment and whether it's, this may not be the right circumstance, in which case please tell me to be quiet, to ask a couple of clarifications on the composition of the committee as written, on the council as written. It's very ambiguous, I think, and maybe it's too late to change it, but as written, several of these roles could be taken up by one person. If each one is intended, it's not clear. And also exactly what their jobs are is not clear.
Okay, so I'm going to suggest, normally I would say, let's just vote on the amendments, but since your question is specifically about the amendments, sounds like Delegate Shetty has a response, and it may be that if we need to change or tweak a word here or there, we could do that on the fly, but I'm seeing that Delegate Shetty doesn't think so. Go ahead, Delegate Shetty.
Thank you, Dr. Hamash, for your feedback and questions. This council does have prescribed duties as outlined both in the underlying bill as well as in the amendments. And that applies to all of the members who serve on the council. As far as the clarification question around prescriptiveness of the type of individual who should serve, that is often written in a way that clarifies the type of individual or skill set in which they are required to have, so that you know that there is a broad perspective of stakeholders at the table. But there is, because the department, and I believe, I might be wrong, but I believe that it's in coordination maybe with the, I'm trying to see who in the language is currently required to do the appointment. Anyway, thank you. Thank you for that. Thank you. So the governor has given some latitude on who to appoint in order to fulfill the requirements, as long as they have the skill set that's outlined. So this is, in my experience, somewhat typical of the type of way that we describe members of commissions, boards, and councils. But I welcome any feedback or disagreement from council on that point in particular.
Thank you, Delegate Shetty. I think to Delegate Shetty's point, and Aaron, you can back us up. This is pretty consistent with how we do things, and would be one individual per.
Yes,
yeah, I'm seeing nods. So if the committee is comfortable with that, and we've had the amendments moved and seconded, I'm going to vote on the amendments. All in favor say aye. Aye. Anyone who's opposed? Okay, so the amendments are adopted unanimously. Do we have any questions from members of the committee on the bill as it is now amended? Okay, no questions is a good sign. How about Delegate Shetty? Can you just give us 2 sentences on why we should pass the bill?
Yes. First, thank you, committee, for your consideration of this bill. I know you all have a lot on your plate. What this bill does is it provides for a comprehensive forum that could help deliberate and provide feedback directly to policymakers, both legislators as well as the regulatory agencies, on ways that we can better support and best support our rare disease community here in Maryland. So thank you for your consideration, and I respectfully request a favorable report.
Thank you. Are there any other stakeholders here who wanted to speak on this bill or say anything before the members vote? I don't see anybody else. We did move in. Did we move and seconded? I'm sorry. I'm now that person who can't remember. Delegate Hill. Delegate Hill, go ahead.
Thanks. And I'm sorry, Delegate Shetty, just clarify for me. I know you mentioned the Council on Hereditary Diseases. And so just to be clear, rare diseases aren't necessarily hereditary. And what you're trying to do is to make a similar advisory group as already exists to genetic and hereditary.
So thank you for the question. The existing group does a lot of work primarily focused on running and implementing the newborn screening program here in the state. And what this bill would do is establish, yes, an advisory council on policies and regulations that can support the members of the rare disease community. And if you think of like a Venn diagram, rare diseases are the larger group, and then within it is a smaller circle of those with hereditary and congenital disorders. So not all individuals who have rare disorders have hereditary or congenital, and so that's the purpose and need for this bill.
All right, thank you.
Thank you, Delegate.
Answer your question, Delegate Hill?
Absolutely.
Perfect. Thank you. Okay, so I heard it was moved by Delegate Bagnall as amended. Do we have a second?
Second.
Moved and seconded. Any further discussion? All in favor say aye. Anyone who's opposed, raise your hand in the chat. I see the bill passes unanimously. Nice work, Delegate Shetty. We're going to return to our conversation on House Bill 111, which is Delegate Charkoudian's bill. Committee members will remember we discussed this last week, and we came back with some questions. We did adopt the amendments last week. I believe there is another amendment this week to discuss. And we also have folks here from SNAP to walk us through our questions on SNAP. So I'm going to go ahead and open up the conversation. I want to be sensitive of time. So it's 11:38. We don't have to, it would be great if we could move on this bill today. I think the amendment's going to address a lot of the remaining concerns but I don't want to rush members of the committee. So let's make sure to get our questions answered and make sure everybody feels comfortable. With that, I'm going to suggest we follow that same process. I want to get to the conversation about SNAP. I think that was really important, but let's put the amendment on first because that's going to resolve the fiscal note issues, which are equally important, and we can focus our conversation. So with that, how about Aaron, you remind us of the bill, talk to us about the amendment, then we'll go to Delegate Charkoudian quickly and begin that conversation. Aaron.
So now the bill as amended, if you look in the reprint that was provided, the bill is all of the bill is now page 2. The rest of the bill has been, the amendments would repeal the rest of the bill. So this would require MDH to establish an express lane eligibility program to enroll individuals in Medicaid and CHIP based on eligibility findings by SNAP. So that is what the bill is down to now and what you all can discuss today.
And we need to adopt that
Should
final
you choose
amendment,
to
though.
adopt the
Yeah. Okay, perfect. Delegate Charkoudian, just on the amendment that we will be voting on in a minute, can you describe that for us so that everybody's really clear? You can repeat what Aaron just said, but tell us if there's anything else we need to know.
Sure. Thank you, Madam Chair. The bill originally basically established that once you get SNAP, you get Medicaid and energy assistance. We've now split those out. So you all will deal with the once you get SNAP, you get Medicaid. And then ECM has a separate bill that will be once you get SNAP, you get energy assistance. So for those of you worried about people not getting energy assistance, we're taking that up in ECM. But this bill is just the SNAP to Medicaid connection, since that's the committee's jurisdiction.
Perfect. Great idea. Thank you for that. And Delegate Charkoudian, to your understanding, does that eliminate the fiscal note to the best of our ability?
Yeah, the fiscal note was related to the increased number of people who would be receiving energy assistance. That's my understanding of what that $30 million was.
Excellent. And I have consulted with committee counsel and we can get some written clarification on that for folks who are concerned with the fiscal note. But that's our understanding as well if we were to adopt this amendment. Delegate Rosenberg.
Thank you, Madam Chair. Question, I know as a matter of English language what express lane eligibility is, but is it defined somewhere in the code? Does it need to be defined in this bill? I don't want to slow things down. I'm just asking.
I think the conversation we had last week was that it's a federal terminology. Aaron, do you think we
Yes.
need it defined in the bill? It wouldn't.
I mean,
be-
I would refer to Trisha Roddy, but I do believe that it's federal terminology. I don't think it's necessary to define it.
Yeah, I would agree. And I think we're fine.
Perfect.
I'm
Delegate
fine.
Chisholm.
Thank you, Madam Chair. So right now, to be enrolled in SNAP, I think it's 185% of the poverty level. Right now, and somebody educate me, with Medicaid, to be eligible for Medicaid, where do you have to be on the poverty level?
If it's okay, Delegate Chisholm, I agree we're going to have this conversation. I just want to have it after we adopt the amendment that takes away the fiscal note and the energy stuff. Are you okay with putting a pin in it until we vote on that amendment?
Absolutely.
Perfect.
Move the amendment.
Okay, the amendment has been moved and seconded. Any further discussion of the amendment? Okay, all in favor, say aye. Anyone who's opposed, raise your hand in the chat. Looks good on the amendment. The amendment passes unanimously. Now back to Delegate Chisholm. We do have some folks here to walk us through all of the SNAP related questions, and then we can dig into the eligibility specific questions and go back and forth between Trisha and get whatever answers we need for that. Does that work for you, Delegate Chisholm?
Yeah, I just want to know how well do the two programs line up? Does it automatically, if it's automatically going to enroll you, is it going to run afoul of any of the Medicaid requirements in order to be qualified for Medicaid?
So this is, I think, the most important discussion we can have, right? What does this express lane eligibility actually mean for the folks who are eligible, and who are we including in this program? So it's really important to me that should we pass this bill, that everybody on this committee have a sense of understanding as to what we would be doing here. So with that, who is here from SNAP? I don't see someone, but I know someone's here. We have a presentation. Is it like a SNAP 101? I think you might be on mute. I can't hear you.
Okay, so let me unmute for a sec. Yeah,
Much better.
Yes. Good morning, Madam Chair, members of the committee. My name is Augustine Hamaganimana. I am a Deputy Executive Director for Programs for the Department of Human Services Family Investment Administration. So with me today is LaBelle Groff. She's also our Director for Policy Compliance and Customer Service Compliance. We're going to do a quick presentation, and it was prepared with the questions in mind. So hopefully with our presentation, we'll be able to answer all the questions that you have. And of course, we take any question, we take questions. Let me.
I think your mic went off again.
For some reasons, it's not allowing me to share and speak at the same time. So what I'm going to do is just going to, walk through the presentation, but you're not going to be able to see anything. So
okay, and we can email that around to members in case they want to reference it later.
Okay, we can do that. Yeah, just quickly, the food insecurity really has changed since the pandemic. And what we're going to do today is really talk briefly about SNAP, but also talk about programs that existed during the pandemic that are going away, and try to give you a picture of what to expect in the short and long term. Okay, so SNAP is the largest food insecurity alleviation program nationally, and that's not any different in Maryland. Before the pandemic, about 720,000 Marylanders received SNAP, and during the pandemic, that number jumped to nearly 900,000. Citizens can apply for SNAP online, in person, or they can also apply over the phone using the help of one of our 31 SNAP outreach organizations. Certain applications are expedited, and that is if the customer does not have any resources, the application is processed within 7 days. And we'll make sure that they have, within those 7 days, they have an EBT card that they can use to start purchasing food. The question that has come up before is, can SNAP benefit be used for other things such as diapers, and hygiene products for women? The answer to that is no. As federal regulations stand today, SNAP benefit can only be used to purchase food. In addition to SNAP, DHS administers emergency food programs. The most prominent emergency food program is the Emergency Food Assistance, which is also referred to as TFAP. That program is federally funded, and basically what it does is allow us to purchase food commodities from farmers across the U.S. and distribute those commodities to Marylanders in need via the community food banks and food pantries. So in Maryland, Maryland Food Bank and the capital areas food bank are our key stakeholders, partners in administering TFAP. However, each of those organizations partners with hundreds of food pantries across the state. So now, what programs existed during the pandemic that are going away? So pandemic EBT or PBT. So this is a program that was authorized via the Families First Coronavirus Response Act, and its intent was to help children who no longer had access to free or reduced price school meals because of the pandemic. Through this program, we have provided services to about close to 600,000 children each year. This program will be going away after the summer, and that's because it was tied to the federal pandemic health emergency declaration, which, as you all know, is going to be ending on May 11th. So another program that was authorized during the pandemic is emergency allotment. Emergency allotment is basically a key provision in the Families First Coronavirus Response Act, allowing states to issue maximum SNAP benefit to eligible households. Now, if
I can put a pause on you for 1 minute, I could listen to this for hours because it's fascinating to me. And I'm looking at Delegate Cullis, and I know we have her bill too. Let me ask you specifically as it relates to this piece of legislation before us. What is left after all the amendments is the Department of Health working with the SNAP program to establish express lane eligibility for individuals to enroll them in Medicaid based on, this is the language in the bill, based on eligibility findings by the Supplemental Nutrition Assistance Program. So my understanding as I read that is that Medicaid would be working with you all to determine who would be eligible for this express lane program. Is that your understanding? And is this something that is working in other states? Can you give us any context of how this might work with you all in the SNAP program to help provide health insurance for the folks that you serve with SNAP assistance?
Yeah, so I'll tell you what we have an existing relationship that we have that we can build up on to achieve exactly what the bill needs to achieve. So right now, as it stands, we use Medicaid administrative records to identify individuals who are receiving Medicaid but not receiving SNAP. Okay, so through that kind of data matching, we're able to conduct outreach to those individuals who are, again, on Medicaid but not on SNAP, and make sure that if they're eligible, that they do enroll on the SNAP. What we don't have in place is to do the opposite, which the bill seeks to do. And so I think there's a lot to be worked out with MDH, and we are very excited to be able to do the reverse to make sure that individuals have access to both SNAP and Medicaid.
Excellent. So right now in SNAP, if someone is Medicaid eligible and enrolled in Medicaid, you have the ability to figure out who might be SNAP eligible from that, and you do that work. But right now in Medicaid, they're not working with the folks who have already gone through the process of becoming guaranteed eligible for SNAP and determining if they're Medicaid eligible. And the point of this bill is to help with that. So I'm going to toss it to Trisha Roddy, who can remind us how you see this being phased in, and specifically answer Delegate Chisholm's question of how do we make sure that folks who we're getting folks who are eligible and not folks who wouldn't be eligible because of different thresholds and limitations.
Yeah. So there would be a data use agreement in place between the Medicaid program and DHS. They would share their files, I think, on a monthly basis. And then we would, again, first, we would look at only folks that are already enrolled in the Medicaid program and only use that for redetermination purposes. There would be a second process to get CMS to approve an automatic enrollment process for new enrollees. So meaning that they're not on the Medicaid program currently. And we would be automatically enrolling them at the initial point of into Medicaid. So again, we're only focusing initially on the people who are already Medicaid eligible on our program receiving services.
And that's the part in our draft before us in the reprint on line 33, provided that the department may propose or implement the use of express lane eligibility for renewals before proposing or implementing the use of express lane eligibility for initial enrollment. So that's written into the bill.
And Delegate Chisholm, so just to Medicaid covers children up to 300% of FPL, and the parents are at 138% of FPL. So when we're talking about a family unit, we wouldn't go up to the 185%. We would only focus on the 138% for that family unit. And then obviously for children, we could go higher, but we already cover children at a higher level than SNAP.
Perfect. Delegate Chisholm, a follow-up.
Possible that people will be enrolled into Medicaid involuntarily?
So I think from the protections in place. So essentially there will be an automatically enrollment. Again, we're only initially focused on people who are already enrolled in our program and are receiving services. So they should already know that they've been enrolled. We're just focusing on making sure and streamlining the redetermination process. And the other protection is that Medicaid is always the payer of last resort. So if you have third-party coverage or another plan, it is our job to make sure that we don't pay those bills, that we go after the Care First commercial insurance carrier in order to, again, assure that Medicaid is not paying or substituting for services that should be covered by a commercial plan.
I think though, because Delegate Chisholm has asked this question before, and I think it's good to have a really clear answer. And this would never be me, but if I were a person who did not want, under any circumstances, to be enrolled in Medicaid, regardless of whether I had another payer, I just didn't want to be enrolled. Is there any sort of affirmative step that I would need to take? Is there a check in place? I see Stan Dorn's nodding his head, so why don't you answer the question for us, Stan?
Yes, thank you very much. I'm Stan Dorn, the Director of Health Policy at Unidos US, Latino civil rights and advocacy organization. Federal law forbids automatic enrollment without affirmative consent of the individual. That the state has flexibility to define how that consent is given, but it is an absolute requirement. So no one will be enrolled without their consent.
So in order to establish this express lane eligibility, which is a federal term, we're following all the federal rules, including the one that requires affirmative consent.
Correct. And even before affirmative consent happens, everybody has an opportunity to opt out of the data sharing between SNAP and Medicaid. But so that's sort of a second level, but that's an opt out. The affirmative consent requirement is absolute, and it has to precede enrollment.
We have an idea of how we plan to get this affirmative consent. Can somebody give me an example of how that works?
Yeah, the most effective way that it was done by Louisiana and South Carolina, where they sent information to the parents. In those states, it was just for children, and said, your child is eligible for Medicaid based on information from the SNAP program. If you would like to enroll your child, you can call us at this number and pick a managed care plan, or you can use your Medicaid card to access care, and that will be the way that you show consent.
Thank you, Madam Chair.
Absolutely. Any more questions from the committee on the bill as it has been amended? Delegate Riley. I think you might be on mute, Delegate.
Sorry. Okay, so you said that we're currently using data from folks that are on Medicaid currently, correct? So we're starting with that group of people. And then automatically enrolling them in the SNAP program.
That what we heard was that SNAP is already doing that.
Okay.
SNAP is already working with Medicaid data. They have a system in place to see who's eligible and to reach out to folks and offer them food benefits if they're eligible.
Okay.
What this bill will do is have Medicaid, starting with their renewals, not have someone fill out a renewal for SNAP benefits and a completely separate renewal for Medicaid benefits if they're eligible for both. Does that sound about right, Tricia?
Yes, exactly.
Okay. So we automatically know that their qualifications are for both. Now, I heard Delegate Chisholm earlier say, which I don't think that question has been answered. Are the qualifications the same for each?
So let me answer that too, because I'm practicing for the floor. So if you don't mind, Tricia, the qualifications are not the same, which is why there's checks in place to make sure that only the folks who are eligible for both would be taking this express enrollment path. So at SNAP, 185% of the federal poverty level would qualify you for food benefits. But if you're an adult, 138% of the federal poverty level qualifies you for Medicaid. So it's a lower threshold if you're an adult. But if you're children, it's actually a higher threshold. 300% would qualify you for Medicaid. So we're talking about different levels, which is why this is going to be customized to the individual enrollee. You would get the outreach from Medicaid if you met Medicaid's eligibility, not if you met SNAP's eligibility. Is that right, Tricia? Oh, she's on mute now.
Sorry, exactly. We have to mirror it only would be eligible to the folks that would actually qualify in Medicaid and SNAP at the same income level.
So this legislation isn't going to do anything to qualify someone for benefits who wouldn't otherwise qualify. The only thing it's going to do is make sure that they don't have to go through two different sets of very redundant paperwork and processes. Is that about right with the express lane?
Exactly.
Okay. Yeah, I like the idea of that. I know in our last discussion, we talked about the percentage. We're hearing that, SNAP, I think the gentleman had said like 900,000 children, 600,000. Last week, I asked the question, has there been any review on those folks that were currently receiving SNAP? And, have they, if you automatically accept what was on their old application, How do we know that they're not in a position now because they might have gotten a job and, now they don't qualify for one or the other? Is that being done as well? Because that could be like, fraud and abuse happening, so.
Yes. So before we get to the answer, I see that the representative from SNAP, thank you for raising your hand. I'm looking forward to your answer. Again, I just want to make sure I'm framing the question correctly, Delegate Riley. We want to know that the eligibility information that SNAP has that Medicaid would be using to start with the re-enrollments in the express lane is accurate, up to date, and doesn't leave space for fraud or abuse. Is that about right?
Yes.
Okay, if you could answer that for us, we would really appreciate it. Oh, from SNAP. Yes, sorry.
Yeah. For SNAP, I can confirm that we actually review SNAP recipients' information every 6 months to determine if they remain eligible for the program. So the worry about a customer who might be receiving benefit when they have returned to work or now exceed income requirement, that's not a concern because we have systems in place to confirm that their information has not changed.
So your information is updated every 6 months. My assumption, and this is a question for Tricia, since she's the one who's going, or someone in Medicaid is going to be setting up this express lane eligibility. I would assume that embedded in this language and the waiver that you would be seeking from the federal government and modeling it after the other programs in other states, that there are guardrails against, to ensure that we're not using out-of-date information.
Absolutely. And with all Medicaid enrollees, they have to report a change in circumstances to us. So we would do an off-cycle redetermination if in fact they reported a change in circumstances. So that's regardless of, that's just a general Medicaid rule that's in place.
And so what do you imagine for the, I'm sorry, I'll ask my follow-up and then I'll go back to you, Delegate Riley. I just want to make sure I have a clear answer on this. In terms of timing, because if SNAP information is updated every 6 months, do you think in terms of developing an express lane, again, for the initial step is just for reauthorization. So these are folks we already know are eligible for Medicaid, which is a lower threshold for adults than SNAP. So they're likely to be eligible. Are you expecting to use data that's months and months out of date or more timely than that?
Well, we'll have to rely on what SNAP has. And if it's 6 months worth of data, that's what we'll be using, but it
would never be more than 6 months.
Right. In terms of whatever the DHS gave us, it would be never more than 6 months. We all of our in the application package, they know that they have to provide or let us know if there's a change in circumstances, if they've had a new job, if they've added a child to their household, etc. They must report that information to us. And we don't wait, we do an off-schedule redetermination of those folks.
Excellent. I know Delegate Riley, you have a follow-up, but I just want to loop back to Stan because you mentioned some other states that are maybe more red states that have a program like this up and running already. Can you just give me some confidence that this is going to work in the way that Delegate Riley is concerned it might not?
Oh, yeah. So states like Alabama, South Carolina, Louisiana were among the initial implementers, and now Alabama and Louisiana are continuing. And exactly as we just heard, SNAP redetermines eligibility every 6 months, and it is incredibly careful in the way they redetermine eligibility. So that actually gives you a more recent income finding than you get with Medicaid, where redetermination is every 12 months.
Thank you, Delegate Riley. I'm sorry to keep cutting off your follow-up.
That's okay. Actually, you kind of mentioned on, so I heard every 6 months your, redetermination or to see if they, anything has changed or whatever, whether they should continue to be on or be off. So you're saying you do that for 9,000 people every 6 months. And so maybe you can explain what that means. Are you waiting for them to call you? Or are you going to their homes to investigate? I mean, that's a lot of people to do every 6 months. So if you could explain exactly what that program is.
Is the question for SNAP or for Medicaid? Is your question?
Well, I guess SNAP, because that's what we're talking about, that every 6 months they're saying that they're going out or they're doing something every 6 months to determine that they should still stay on the program. Can someone explain to me what that means? Are you leaving it up to the person that's on SNAP to just call you and say, oh, I have a job now, take me off of SNAP? Or are you going to their home, or is there other paperwork? So what happens every 6 months for these 9,000 people to show that they're still qualified?
Go ahead.
Yeah, so just quickly, high level. So yes, every 6 months we reach out to the customer to ask them to basically reapply, okay, to renew their case, okay. They have an opportunity to give us to let us know whether or not there's their circumstances have changed. But like Medicaid, they are also required to. They don't have to wait for that 6 months. Law requires that they inform us of any changes in their household situation, whether that's a new job they obtained, whether that is a new member in the household or somebody left the household. All that information must be reported. I
think the specific question, and maybe Ms. Hillgrove can get to this answer, but let me reiterate it, is can you tell us at the 6-month eligibility determination, what type of documentation is required for eligibility? Was that what you were going to weigh in with, Ms. Hillgrove? Go ahead.
Yes, great day. Thank you for this opportunity. So every 6 months from date of application, a customer has to interact with the local department or the state of Maryland. So at the 6-month mark, we're checking to see if there are any changes in your income, your household composition, shelter expenses. Then in addition, an additional 6 months, which is your end of the certification period, which in broad terms, some certification periods are 12 months, some are 36, some are 24. But at that 12-month mark, then we do a full interview. So it doesn't have to be face-to-face, but there is verbal communication between the local department and the customer receiving SNAP. And at that time, regardless if there's a change or not, they have to verify their income, shelter expenses, and also household composition if there should be any changes.
And so just to be clear, the verification is not just self-reporting. I think that's what Delegate Riley was getting at, that we're not dependent on people calling up and saying, hey, I no longer want to be eligible for this benefit, that there's some mechanism in place to ensure that it's more thorough than that.
That is correct. So we mail them out the Maryland Benefit Review Form. So that's at 6 months, and then also the recertification at 12 months. Prior to that, at least 30 to 60 days prior to their actual due date, we mail that out to them to make it aware, and they also do have to return documentation. I will say with the caveat at the 6-month mark, they do have to report if there are any changes. So therefore, if their income did remain the same, there weren't any changes, they do not have to provide verification. But we also do data matches within our work number, also with Maryland Department of Labor. So that therefore, if there's anything that does not align with what it is that they're reporting, we do have the liberty to ask for additional verification for questionable situations.
So there's a data match with the Department of Labor that takes place that would flag anything if there was something unscrupulous.
That is correct.
Excellent. Delegate Riley, follow up?
Yes, thank you for the answer. Excellent answer. I do have one more question, I promise. And that was, so we mentioned that there were 600,000 children that were on SNAP, okay? And with the federal, because of, COVID and everything, with the federal match ending on May the 11th, I believe you said. So we have to do this before that time frame, is that? And who's paying the whole amount after the federal government is no longer giving us funds for the SNAP program? Or are they going to continue?
I think that's a different question. It's a question larger than this bill. This bill is not related to that.
Okay.
That's a bigger and different. Did you want to weigh in though? Did you have a quick answer to that, or?
It's a different program. It's pandemic EBT, which is different from SNAP. And so again, separate from this discussion, I guess. Yeah.
Okay. I heard you mention it. So, okay. Thank you very much.
Perfect. Any more questions from members of the committee on this? I don't see any more questions. I don't see a lot of committee members left. Does someone want to move the bill as amended?
Amendments.
Moved and seconded. Any further discussion on the bill as amended? I want to thank Delegate Charkoudian for her hard work on this and getting us amendments that could really address a lot of the issues that were raised. All in favor of the bill as amended, say aye. Aye. Anyone who's opposed to the bill, raise your hand. I see Delegate Chisholm's hand. That's a no vote. I see Delegate Riley's hand. That's a no vote. Okay, that's all I see in the committee. So let me make sure we have Delegate Bagnell, we have Delegate Hill, we have Delegate Lopez. We have Delegate Rosenberg, we have Delegate Alston. You're a yes vote, I assume, yes. A Delegate White we have here. I just want to make sure we get a note since it looks like I was really hoping we didn't need a party line vote on this, friends. Okay, so it does pass, but in a, I guess, philosophical difference.
I may change in committee. There's still a lot that I want to look into to investigate, just to make sure that I understand what I'm voting on, and at least it'll give me time.
We need time. So
We're
say we
happy
need
to make
time.
sure you have time and you have established relationships. You can now, with this subcommittee discussion, we can follow up on any further questions you have.
Thank you.
Absolutely. So with that, we have one more bill and 6 more minutes to do it, but I believe in Delegate Cullison, so I think it can be done. House Bill 340, which is the Maryland Department of Health 211 Maryland Oversight Bill. Erin, can you remind us?
So the bill alters the definition of Health and Human Services Referral System to mean a coordinated system for health and human service resources accessible to all state residents through 211 and other designated technology systems. The bill would repeal the requirement that the Maryland Department of Health, in consultation with 211 Maryland, evaluate the performance of each 211 Maryland call center and make recommendations to 211 Maryland regarding the quality of service provided by call centers or the performance of call centers when issues related to service quality and performance are presented to MDH. There were no amendments offered.
No amendments. I know Delegate Cullison was on the call. I think she might have had to hop off because she's a very, very busy woman. Do we have questions from the committee on this bill? Seems pretty straightforward to me. Any discussion on this bill? Anybody want to move the bill?
Move the bill.
Moved and seconded. Okay, any further discussion in the lack of discussion on this excellent bill from Delegate Cullison? Everybody wants lunch, but this is a great bill. I think everybody's on board with it, so I think we're in a good spot. All in favor, say aye. Anyone opposed, raise your hand in the chat. I see no one opposed. Passes unanimously. Go team, enjoy your lunch. Thank you for your patience with this harried subcommittee and appreciate all your good work. Have a good one.